Okay, so we are waiting a couple of minutes to have a little bit more people connected, and then we will start with the seminar. Okay, today we have very interesting topic. We will talk about redefining facial contour with cell boosters. Okay, I will since this minutes to present myself. I'm Dr. Sebastian Torres. I'm a plastic and maxillofacial surgeon in Italy and in Chile. At the moment, I'm in Sicily with my family. So we have a nice weather here, and it's a pleasure to be presenting these products for you guys. And it's a pleasure to work with CELL because it's a very good company with very serious products that I have been able to try and to love more and more with every day that passes. So I will wait one more minute and we will get started. Okay, we have more people getting connected, so just one more minute and we will start. If you have any questions, please send the questions on the question and answer option that we have on the screen, and I will be answering at the end. Because it will be a very dynamic presentation. I promise you that. You will have fun, you will enjoy, and hopefully you will get something new out of this presentation. We are preparing as well a big surprise for you. We will have electronic or streaming plays for AMWC this year for you. So try to get connected because there's a good prize coming for all the people that will participate from this seminar. Okay, this year will be the 20th anniversary of the Congress, and I hope to see you all in Monaco as well. So okay, I think it's time to get started, and let's go. As I told you, today we are going to be speaking about redefinition of the facial contour with cell boosters. Okay, different concept, different product, and we will see how it is. So let's imagine that you have a rock and you want to sculpt this rock. Okay, you want to give some shape to the rock. So what would you do? What would be your first option? Obviously, you need some hammer and chisels to be able to destroy the material, remove the excess volume, and to give shape. In that manner, you will be able to produce very nice and pieces of art, as we have in Florence, like Davide, which is a symbol of beauty, a symbol of the Renaissance, a symbol of excellence, because all the shape is very symmetric, harmonic, and everything is perfect. Okay, so let's say now that you have a bucket. You have a bucket that you have to pull. You want to raise water, you know, and you want to pull this bucket to be able to wash your clothes or just to drink. Okay, because you want to lift from a water well this bucket and to be able to extract the water. Okay, and what would you do? Hi to Malta, people from Malta. Okay, so what would you do to lift this bucket? Okay, obviously you need a pulley. Okay, and you need some extra force to be applying to the bucket to be able to raise it. Okay, so you will be like pulling through the pulley and be able to raise the bucket that has a weight. Okay, to extract the water from the water well. So these are solid and inert substances, okay, that they won't change if you don't apply an extra force, an external force, to be able to alter the rock or the bucket. So you have to do something from the outside to be able to change these substances from the inside. Okay, but when we are treating fat is not like that. Fat is a living tissue, so it will interact with the environment, it will interact with the other cells, and it will interact with foreign substances that you will be introducing. because we have an extracellular matrix as well that is a dense net of fibers with retractile capacity, which is totally different from a rock, and it's totally different from a bucket. So we have to start just thinking a little bit differently, because when you have cells, you have intracellular interactions, you have intercellular interactions, and of course you have as well extracellular interactions as well. So you have several opportunities to alter, innovate, or enhance these pathways in between the cells. Good morning. Buenos días a todos de España. Good morning from London, Cyprus. Thank you for being here. Okay, so you have so many different things that you can do when you are treating cells, okay, and not rocks. And we tend to like forget about this. So you have to be able to think out of the box, okay? Don't think in the old manner with chisels and hammers and pulleys and ropes. We don't need that, okay? You have to be able to think differently because we are treating cells, okay? So we have a question, and the question is there any room for non-invasive corrections, okay? When we want really tangible result? And the answer to this question is obviously it will depend on patient expectation and of the anesthetism severity, of the technology available that we have, and of the patient wishes, because there's always a winner that has to be parallel, okay? Patient's expectations or wishes and the result that you're giving, they have to be parallel, okay? If a patient wants a 90% improvement and it has a very terrible anesthetism, then obviously you have to be more aggressive, okay? If the patient wants a minor improvement, 20, 30%, then you can be more subtle, you can be less invasive, and you can tend to improve with easy options, okay, easier options. So here you have invasivity and you have severity of the anesthetism. And what I tend to promote is that you should be proportional between the expected outcome and the anesthetism severity, okay? So when we are talking from non-invasive corrections, we tend classically to promote that surgical corrections will give above 70% of improvement, okay? Whereas non-surgical corrections, they can only provide a 30 to 40% improvement. That is the classical mentality that we are all raised with, that we are all trained with, and so we tend to repeat and repeat and repeat that to our patients, okay? Good morning from Poland, okay? Malta, good morning, okay. So let's keep on going. Okay, so new technologies allow better results in less invasivity, okay? When we are talking about electromedical stuff, we can name Vaser, J-plasma, BodyTite, and we know that it's very low invasive technology that will give results that are above 60 to 70%. So we are not quite in what we used to say that it was non-surgical 30%, that is obsolete, okay? And we are talking about as well injectables. We may talk about cell boosters, peptides, and enzymes. And this, depending on who you choose and why, you will get results that will be above 30%. So what we were used to be taught is obsolete, it's not valid anymore. Okay, we have new technology and we can give better results to our patients. Nevertheless, it's not really invasive. So redefinition of facial contour is possible with cell boosters. Okay, you can totally change the way our patients look. We can totally rejuvenate their aspect with cell boosters. So what are the cell boosters? And as I say before in other topics, in other webinars, in other congresses, cell booster is a new technology, it's a new article, and it's a new concept because it has this CHAC technology, okay? So it's something that we are putting below on the subcutaneous tissue, and it's acting on the cells, and it's acting as well in the extracellular matrix. So this device is completely different because it has several advantages, and one is the CHAC technology, which is stabilized three-dimensional complex, which is stabilized, has hyaluronic acid that has been stabilized, has been stretched, and in the slots that comes out of the stretching of the molecule, they are placing active principle, which can be amino acid, vitamins, and so forth. So what you get when you remove the tension of the molecule is that the molecule contracts, and once you release that molecule into the tissues, what happens is that the hyaluronic acid starts melting or degrading day by day and releasing active ingredients day by day. So that's why with one session of these materials, you can get results that are much better than with 5 sessions of the regular molecules that we have been injecting for ages. Remember, like Yalu Pro, all these other materials, Profilo, even the Spanish enzymes are pretty good, but they're not as good as this, because most of the things that we inject in the skin, they last only 24 hours, 72 hours. With cell boosters, I have the impression, and we have had the clinical outcome, that they really work, that patients are really happy. So every day that I try these products, I even happy with the results, more happy. So we have minimized the active ingredients degradation because of this CHAC technology. We increase the availability of the active agents, and we are protecting as well the hyaluronic acids, because by doing this structure, we protect the hyaluronic acid and we protect the active ingredients, okay? Obviously, CELL is Swiss, and they have high quality standards. We all know that, okay? And we have the possibility of giving long-lasting results for our patients, okay? So we have this unique patented technology, and we have the Swiss confection, or the elaborating of the material, with this in Yverdon-les-Bains in Switzerland. And so we have a better product. That's it. That's it. Making it simple. This is a different product and much better that you have tried in the past, okay? And so we have no chemical binding agents. We have no BDDE. We have a slow release of active ingredients, and we have a unique complex ingredients combination, okay? So it's something different. It's useless to compare CELLBOOSTER with another technology, because I am a surgeon. I tend to be very critical with all the materials that they come, okay? But this is something different. You cannot compare with other, because this is not mesotherapy, okay? So you have, as I told you before, we have the stretching of the hyaluronic acid molecule, you have the complex link formation, and then we are talking about something different that the Swiss cell called CHAC complex formation, okay? Everything done under pressure. You stretch the molecule, you release the slots within the hyaluronic acid molecule, and then you're placing active ingredients all over the molecule. And then you release the tension, and it gets close, and so you can be giving better results. So we have a wide range of products available for different anestheticism, that today we will be talking mainly about shape and lift, okay, which are the ingredients that allows us to sculpt the face. Obviously, you get as well glow for the pigmentation and hair, which is an excellent product I have done in myself, as I was losing a little bit of hair and getting a little bit of gray because of the stress of the pandemics, and I don't have to tell you about that, you know it better than me. So the key ingredient in the molecule is the hyaluronic acid, okay? That is being stabilized in a different way, non-chemically, okay? It's a physical stability of the hyaluronic acid, so it will stay longer and it will produce better results, okay? So hyaluronic acid, it's a moisturizing agent, and when we lose it, obviously the nourishment of the collagen and the skin firmness is compromised. So hyaluronic acid has a very short life. It lasts 3 to 5 minutes in the blood, and it's very sensitive to free radicals, okay? So that's why we need a different sort of agent. That's why when we inject common mesotherapy, that it looks fine, and it gives like a evanescent aspect or improvement in the skin, it won't last because of all these external factors that we have: hyaluronidase, UV exposure, pollutants, and chemical stress. Okay, so that's why the stabilization of the CHAC molecule is so favorable for the viability and the stability of the hyaluronic acid. But as well, the CHAC formation is very useful as well to protect the active ingredients and to be able to release them in a continuous manner. Okay, let's say that you have inflammation in the knee. Okay, and let's say that you took acetaminophen of paracetamol or an aspirin to get rid of this inflammation. Okay, this is like having a slow release medication that will last in your tissues for like 3 months. So let's say that would be possible. Okay, you take one pill and you get anti-inflammatory effects on your knee for 3 months. Obviously, you would be rid of inflammation, you will be free of pain, and you will be free of all the involvements that has the inflammation in your knee. And this is something that has been created for the skin. But with this technology, of course, we would be able to treat many other diseases, even to be able to do chemotherapy, I think, in the future. Okay, so this is a very bright idea that they had, and we have been able to observe clinical outcomes that we weren't able to observe before. So this powerful patented CHAC technology is an optimal skin transporting vehicle to deliver the essential nutrients and to permit an effective delivery of them and to avoid the degradation. So it will be able for the first time to deliver enhanced, long-lasting results, even with one single application. Okay, I'm always pushing things further. Okay, I'm always like tempting new treatments, and today I'm going to present you some very interesting outcomes that I have with this product with only one session. Okay, so CHAC Technology, it's all about protecting the ingredients from the hyaluronidase. Okay, increasing the bioavailability of these ingredients, having a physical stabilization of the hyaluronic acid, and to choose the optimal active ingredients and to be able to favor optimal distribution to have more efficacy. Okay, so when we are talking about the CHAC CELLBOOSTER, we know that this is a product that has been created to reduce local fat accumulation. Okay, to reduce water retention, to improve microcirculation. It can be used in the double chin. It can be used for cellulitis, liquid retention, and lymphatic drainage. And it can be used now for buccal fat pad atrophy. I'm going to show you that today. Okay, so the indication of this product are local fat accumulation, sagging in the skin, double chin, fat cheeks, cellulite, water retention, puffiness, edema. Can it be used in the body? Yes, it can be used in the body, but it's intended for the face. Okay, why? Because of the concentrations of the active ingredients. Okay, so if you increase the amount of liquid that you're injecting, you can have good results even in the body. Okay, but with 1 vial or 2 vials, you will have amazing results in the face. Okay, I have tried in the body. I will be presenting that as well in Monaco, but today we are going to concentrate in the facial district. Okay, we have 3 different components in the vial. One is hyaluronic acid, one is L-carnitine, and the other one is vitamin C. Let me see who is making. Okay, I have some. Oh, Morocco, Georgia, nice to see you here. Okay, so we have these 3 components, okay, that are going to be helping us to obtain what we are looking forward to have. So vitamin C, we all know that it's a fat, it will increase fat burning as a workout booster. Okay, so if you have high concentration of vitamin C in the tissues, like by making exercise, by exercising, you will be burning 30% more fat with moderate exercise. Okay, So you will increase the result that you will get from your physical training, okay? And the other thing that CELL is not mentioning, but I want to mention, is that we have been using vitamin C in high concentrations to induce the apoptotic death of the adipocytes. So when you inject vitamin C in high concentrations, you have an apoptotic effect over the fat cells. You get rid of them with no inflammation, because it's programmed cellular death with no inflammation. And so you will be removing fat cells just because the concentration of vitamin C is high within that tissues that you're injecting, okay? The other components is L-carnitine, that is well known for all the people that like sports and they have been training, because obviously when you consume L-carnitine, even via orally, you will reduce fat accumulation, water retention, and puffiness, okay? So it will get decomposed on with the acetylcholine release and coenzyme, and it will normalize the metabolic processes and will stabilize the cellular membrane. So it has a draining effect. It will reduce liquid congestion, okay? It's a very good material, but I haven't, this is the first time that I tried injectively over the tissues, and it makes something much more better, much more localized, like a sniper, okay? You are just shooting to some tissues. You want to get rid of the puffiness, get rid of the volume, get rid of the fat cells in that tissue, and it works, okay? And with the vitamin C, it works even better, okay? So the program, the company is providing us this schemas that you have to be flexible, okay? You have to have an intensive course, 3 treatments with 2 to 3 weeks interval, and then you have a support course, 1 treatment per month. But of course, you can modulate yourself. It depends on the patient. It depends on the budget they have. But the more you inject on one single session, the more effects that you want to have. So if you want to be sure that the patient is going to be happy, put 2 vials, 1 treatment, and then let them come in 15 to 20 days, get pictures, and then be happy, both you and the patient that you're treating. So when we switch products, now we are going to talk a little bit about CELLBOOSTER Lift. We have all this diminishing agent effects of filling soft tissues, preventing oxidative stress, and providing deep hydration. It will stimulate collagen production. It will improve microcirculation and cell nutrition. Okay, will enhance skin redensification. It will lift and smooth wrinkles, and it will improve skin tone and microcirculation. Okay, so this is not the first product I have tested for lifting the tissues. You know, we have been injecting some mesotherapy preparation that they provoke some inflammation. You get some sort of lifting from that. You know, we have the experience with the threads, PDO threads. We have this Giallo Pro Italian product that did work, but the problem is that you had to do so many sessions, you know, and the patients were tired about puncturing themselves every week, you know, and the amount of money they were paying was way too much according to results that they really obtained. Where CELLBOOSTER Lift is faster, CELLBOOSTER Lift is cheaper, and the CELLBOOSTER Lift is even better than any of these products that we have tried, okay? So I have been injecting in very difficult cases, and nevertheless, I have had very nice results, and patients are really happy. So the indications of CELLBOOSTER Lift is the loss of firmness in facial tissue and contours, dehydrated skin, wrinkles, skin laxity, loss of skin tone and elasticity, and cuperose. And of course, you can combine it with CELLBOOSTER Shade to have overall sculpting of the face. Okay, so when we analyze the ingredients within the vial, we see that hyaluronic acid is still present there. We have a pool of amino acids like arginine, glycine, lysine, proline, and valine, and we have vitamins like B2, vitamin C, vitamin E, and biotin. So maybe there's some similitude, there's some, when comparing just the formula, it's kind of similar to other products that we may have had in the past, okay? But the problem is that the technology, the CHAC technology, makes this a different human being, a different type of animal. Okay, it's just like the lion of the jungle. Okay, it's something so much different because of the technology. It behaves differently. Okay, just I don't want to be just convincing you. Just try it. Okay, just give it a try. Ask your patients, even for free. Okay, you can tell your patients, okay, I'm gonna just you know, give this treatment for you one for free. If you don't like it, you don't pay it. And I'm sure they will pay it because it's so much different to anything else that we have tried in the past. Okay, so this amino acid this amino acid and hyaluronic acid mixture, okay, it will improve skin densification, microcirculation, wrinkles filling. It will promote deep hydration, stimulate microcirculation, improve skin tone elasticity, smoothness, collagen synthesis, and it will support tissue remodeling and healing process. Okay, so many things. I say, is it possible? Well, try it, and then you tell me if it is good or it's not. Okay, so vitamin B2, C, E, and biotin will improve the skin defense. Okay, the microfilm that protect the skin will be enhanced. Okay, you will be protecting the fat and the cells from free radicals, oxidative stress, and preventing lines and wrinkles. And it's the same protocol that the company advised, 3 sessions that are followed for after that for 1 session per month. But obviously you can alter this as you wish. The important thing is that you can apply it mainly on its own with no fillers, because you have to be able to clean the result, and you'll be amazed on how much you can improve just with cell boosters. So always they come with the same question: is should we deliver them with needles or with cannulas? And the answer is both. Okay, it depends on how you feel confident. It's dependent of where are you treating. Okay, you can inject it with the needles, with any technique, bolus, linear, fanning, cross-hatching. It's up to you. Okay, but we will favor cannulas when we want a wider distribution of the product, when we want fewer entry points, when we want a fewer or less trauma in the tissues, when we want to be able to apply a linear multipass technique, on when we are applying, for example, the lift product is useful because we can apply the product favoring the vector retraction of the with the threads. Like the same we're doing with threads, we try to do the same with this product, applying vectors of retraction that will raise the whole skin for retraction, to enhance retraction. Okay, so fanning, it is possible. You can do this with needles or cannulas. Okay, I prefer to use cannulas when I'm using lift, and for shape I would recommend needles. Okay, I think it's better. You kind of grab when we are now performing high definition liposuction. What we do is that we grab, you know, the fat tissue, and we get inside with the cannula and we remove everything that we want. So shape is just the same thing. You grab, you know, the piece of tissue that you want to be melting or reducing, and you just go with a needle and you try to distribute the molecule as much as you can in the target tissue. Okay, bolus, of course, it would enhance the action. Maybe bolus you can use it when you are applying on the buccal fat pad. I'm going to show you that a little bit later. And of course, bolus is the easiest way to apply it, but you have to be sure that you're not inside a vessel. Okay, let's say that you inject inside a vessel. What can happen if you inject cell booster inside a vessel? Well, cell boosters are not viscous. Cell boosters are not filler type of product. Okay, so you won't get any obstruction of the vessel. You cannot get necrosis from this product. Maybe you can get some sort of vessel irritation because of the vitamin C and other agents that can be a little bit more irritative, but you won't get obstruction. Okay, but nevertheless you have to try to avoid injecting intravascularly. papulas. If you want to deliver the product all over the face, it's a good option as soon as you have a patient that is willing to be punctured like 30 times, and be sure that you're applying it with a 32 gauge needle, which is much safer and more comfortable for the patient. Okay, so let's see some results. Okay, let's go. This is 1 session, 2 vials. Okay, so this is 1 session, 2 vials. I'm going to repeat it twice. 1 session, 2 vials. 1 session, 2 vials. And you can tell me, of course, oh yes, but she's with a different posture, you know. At first she's a little bit like this, and then she's a little bit like this. Okay, yes, I agree with you. But it's an injectable, okay? If you have shown me this picture 5 years ago, 7 years ago, I would have bet my soul to the devil that it was a neck liposuction, okay? And even neck tight, okay? You have a completely different definition of the neck. You have a melting of all the fat that is in below here. And we did this with only 1 session. Yes, we injected 2 vials, so the patient had to pay a little bit more, but it's a surgical outcome. It's something that looks completely the same as a neck liposuction. So I always am questioning myself, do I need to liposuct every neck? Well, clearly we don't need that to do that anymore. I mean, we have options there now. So it will depend on the patient will to undergo a more radical treatment, because we can give very tangible results with very low invasivity agents. Okay, that is something completely different. Okay, it's not just a posture. Okay, you can grab the tissues, you can feel how the fat is melting. It's not there, you know, and we just use 1 type of cell booster. What would have happened if we have used 12? Like if we have combined shape and lift, would it have been any better? Probably yes. Okay, so it's something different. We are obtaining different results. We are obtaining much better outcomes because these products are so different than anything else we have tried in the past. Okay, and as I told you in previous seminars, I wasn't really trustable with this product at the beginning. I start just giving them up to my patients for free for the surgeries that I was performing, in change for a positive comment on my social media. And sometimes they were even happier with the cell boosters rather than with the surgery. So that's why it makes me like a little bit like to rethink everything. Okay, because what we are taught is not like that anymore. Things are changing. Technology is coming to get rid of the surgery. I mean, I'm a surgeon. I would like, I gain more money for surgeries, and I like doing surgeries, but the more that we go to the future, the less surgeries that we will be performing. That's for sure. Okay, this is another case I want you to observe. These are the points of application of lift, just lift. One session, 2 vials. 1 session, 2 vials. And I don't really break too easily, but I'm worth it, 'cause I'll slip into your dreams. So yes, I agree with you that I can still make it better with a Mac lift, with a regular cut here. Okay, I can still make it better. Okay, so this for me, it's maybe, you know, 30%, 40%, maybe 50% improvement for what she has. Okay, her whole face look like pulled a little bit. Okay, but it's been only 21 days, and this product will act for 3 months, for 90 days, so it will get better. Okay, the time that I have to expend to make a Mac lift is around 3.5 hours. Okay, We have all the possibilities of bad scarring. We have all the possibilities of the flap necrosis. We have all the possibilities of hematoma, neuropraxia, paralysis, facial paralysis. So you have to know what you're doing. But here you can do a totally like tangible result, totally like the patient, they will be able to tell the difference, but you're not risking anything. And it will take you like maybe 10 minutes, 20 minutes. So it gives, it worth a try. That's my full message of this speech is that you, if you don't have tried it until now, then you have to try it. And then you will be the only one with your patient that they can speak the reality of these products, that they are different. You know, look at the nasolabial folds, look at the labiomental folds. They look different. Okay, I was injecting all over and I was trying to retract the skin. Of course, she has some malar mount, some jowling here still, but it's not a facelift. So for what I have done, I'm pretty happy with the results she has had, and she was very happy as well. Frontal view, you know, the whole face looks rounder and shorter because everything went up. Okay, and the folds were like release of this like the dimness. She looks so much better to me. Okay, and she's happier. I mean, I wasn't asking her to smile, but she was so happy that she was smiling when I took the pictures. Okay, and now we present a different idea. That's what I put this above for you, because it's a different application. This is the first time we applied for buccal fat pad, and let's see how it goes.
You're like a circle that floats around me, keeping me safe and sound.
This we did all in one, 4 vials, 1 session. Bilateral visual fat pad application.
I was down with an illusion, like a sparrow with broken wings, but now I shine with your reflection on me. I'm getting back up on my feet. That you showed up was written in.
Well, I kind of cheat a little bit on this one because I wasn't supposed to talk about CELLBOOSTER Glow, but let's talk about the first two, okay? Shape and lift. So what we see is that by applying some lift, we obtain, and shape in this part, we obtain a redefinition of the mandibular angle, yes, and of the mandibular border, okay? By applying CELLBOOSTERs over the visual fat pad, what we obtain is a definition of the zygomatic prominence here, okay? We obtain a better definition of the transition between the zygoma and the middle cheek because this fat got atrophied. And we also obtain some improvement in the skin spots that we have. Is the hyperpigmentation. There's a lot of improvement with 1 session. Okay, so I have removed so many fat pads in my life, buccal fat pads, and it's not a really easy surgery. For some it is, but I think it has some risk, like there's a lot of vascularization towards the buccal fat pad, and there are some very important vessels that they can start bleeding. And I have had some complications with that in the past because you have some maxillary artery bleeding that comes from the internal carotid, which is high flux, high volume. So why not trying CELLBOOSTER shape over the buccal fat pad and give it a try? Okay, see how it looks different. The patient, the face, it looks different. Okay, the zygomatic buttress looks much more marked. You know, you have this transition between the middle cheek and the zygoma, which is more marked. The face looks a little bit more sculpted. but it's just one session. I mean, if you apply to the program, if you do the things the way they CELL are telling us, of course the results are going to be better. But I want to push the limits. I want to be able to show you how much I can obtain from just one session. This is what you can obtain from one session, and I think the results are pretty good. See, you have the definition of the transition of the mandible body, and then the middle cheek and the zygomatic matrix looks a lot more marked. Okay, so to end this presentation, okay, I want to tell you that the important thing is that you have to be able to like get in the past and leave to the past the Stone Age. We are not in the Stone Age anymore, okay? And to start thinking differently, to start thinking more plastically, okay? You have to be able to understand that we are treating tissues. We are not treating buckets or stones, okay? So if we are treating cells and we are applying substances that they interact with the cells, we can have different and better results. If we are injecting substances that are making a difference in the extracellular matrix as well, then of course we can have better results. So think differently. Don't be afraid to think differently. Don't be afraid to offer new treatment to your patients with better outcomes, and start thinking cell booster. Okay, and this is they asked me to ask you to follow CELL.pro. Okay, there you can find more videos, more tutorials, and more experiences. Okay, and this is what they asked me to tell you as well, which is that CELL will give away a virtual ticket for AMWC. Okay, and the details are posted on the Instagram account. So I will be presenting more novelties in Monaco for you, and these are my my social media if you want to follow me. Okay, and now we have a time for the answers, I think. Okay, so we have some questions here, and this is the first question is, can I use shape for fat under the eyes? Yes, you can. Okay, yes, you can. You will favor no inflammation. You will have a little bit of puffiness because of the liquid that you're injecting, but because it's a stabilized hyaluronic acid, now you know the volume here that you will be injecting, it can last for up to 3 months. So be wise. If you're injecting a shape under the eyes, inject it with a very fine needle, 32 gauge needle, like place the product over botulinum toxin serum from the BD. The ones are very little, 0.3 ml. Place small amounts, massage it very well, and then put your patient under arnica cream or gel and arnica pills to get rid of this lymphatic congestion. Give some time, let's say 2 to 3 weeks, and then if you need, you apply more. But don't apply too much because the hyaluronic acid has been stabilized. Okay, it's not a filler. It's something that is not viscous really, but obviously it will stay for 3 months. So be wise with the amount that you're injecting. Okay, that was one question. So the main component of CELLBOOSTER is hyaluronic acid. Okay, and what is the benefit of injecting hyaluronic acid in the third layer of the skin? Okay, so the hyaluronic acid is valid, okay, for the nourishment of the skin. We all know that. If you're injecting hyaluronic acid in the subcutaneous tissue, it will hydrate all that is above. Okay, but you have to remember that hyaluronic acid as well is sort of a glue towards the active ingredients that we are using. So if you are injecting this CELLBOOSTER shape, for example, inside the fat cells, it's because the hyaluronic acid is your carrier of the vitamin C and of the L-carnitine to be able to melt the tissue away. So it's like a double thing. You can use the hyaluronic acid or you can use the active ingredients, or you can use them both. If you're using hyaluronic acid for skin hydration, you can inject it more superficially, and you can use as well the active ingredients, and you can inject them more in a more subcutaneous or intra fat ambient. Okay, so it's up to you what you're looking, what's your outcome, what you expect from the treatment, and how you can do that. Okay, so let me see, there's a lot of comments here. Can I use shape of the eyes? We say that, yes. Hello, you can use shape under the eyes, yes. Okay, how many I can inject in one session? There's a limit. Okay. Okay, let's say if we are talking about phosphatidylcholine, which one of the better dermatologists in Brazil, Doris Hexel, very well known, she introduced me to that treatment like 20 years ago. Phosphatidylcholine produce you know, the lysis of the adipocyte, and because of the lysis of the adipocyte, there's a lot of contaminants and toxics that come out of the cell, like triglycerides and glycerol, that they have to be removed because they are toxic. Okay, if you're injecting cell boosters, there are no toxics, because if you get rid of the cells, it's not by lysis, it's by apoptotic death, or is by which would be like a programmed cell with no inflammation. So because there are no toxics that are released, there's no such limit like of safety. Okay, there's a limit regarding what is like recommended, and I have done one treatment, 4 vials. Okay, because you have to give some space for the product to be able to show what it's the benefits. Okay, and I don't think that by injecting, let's say, 60 vials, you will get any like a better benefit than by injecting 4 in one session. But I can tell you that 4 in one session, they make a difference. Okay, maybe if you inject 1 vial per session, you will have to be using the protocol. So 1 session, 1 vial, and 1 to 2 weeks after 1 vial, 1 to 2 weeks after 1 vial, 1 to 2 weeks after 1 vial. Or you can do 2 vials 1 session, or 3 vials 1 session, and then make your patient come back in 20 days time, 21 days time, when you have no inflammation and you can start to see the results. Okay, so it's up to you. Can you tell us about Cell Booster hair? Well, it's not the topic of today, but yes, I can tell you that in my case, I have tried so many different products that didn't work. I have had 2 hair transplantation on myself. And because I work too much, my hair continued to fall, and my hair is always grayer and grayer. I don't have any dark hair anymore. You know, I'm older than Antonio Banderas right now. So what I'm doing is that I start testing this product in my scalp, and I was very happy because with the first session, I stopped losing hair. And when I apply 3 times this product in my scalp, what I tend to see is that I don't know how, and I don't know why, you know, the hair, it got whiter, and the color of my hair start reverting the grayness. Okay, I don't know if it is possible. I'm not a dermatologist, but you know, the pigmentation in my hair looks better, looks darker. Okay, so I think it's very good product, and you should try it because your patient will be happy, and it's very different from anything else. So thank you so much. What's about the interaction of the booster with Botox? Okay, good question. So when you have Botox, you are acting over the expressive movements of the face. Okay, you are modulating the way we express the face, and of course it is something that is more camouflage than corrective. Okay, so cell boosters are more corrective, they are more curative, so you can totally apply them both. You can apply Botox to have you know, the level of the skin more flat, even, and then you apply cell booster to have like a better overall enhancement of the skin, removal of the wrinkles, and rejuvenation of the skin. Okay. What else? Is it possible to inject cell booster with a mesotherapy gun? I haven't tried it, but yes, it's possible. Okay, I don't see why not. I think it's a good thing to inject it if it is better for the patient, if it is a little bit easier to inject. Okay, cell boosters here, we have talked about that as well. How many days pass to see those good results? 15 to 21 days. You have time to do one. I can use with microneedle. Yes, you can use it with microneedle as well. So the cases I show you, they are like 15 to 21 days. You know, the girl that we injected, the lady that we injected 4 vials, it was 21 days after, and the other 2 were just 15 days after. Okay. So se aplica las bolas de billar por dentro de la boca. Yes. We are applying the product from the inside of the mouth, okay? This is the first application worldwide. I was the one that came with this idea, which is a bit crazy. I hope to be able to show you better and in a more important way in Monaco, okay? We will start preparing videos for you to apply the correct technique. I think that for teaching purposes, it's better to apply it with cannulas, okay? That needle is also possible as soon as you know where the vascularity is, okay, where the vessels are, okay. Yesterday I attended a seminar about ultrasound in the face to improve the injection techniques, and I think that Bishop fat pad is something that we should consider injecting with ultrasound. But I have been having very good results. We are preparing a publication for a couple of months, maybe 2 to 3 months. It will be ready. So I will have all the information in like 2 to 3 months, all the protocol effective for you. But I think it's something very different. It's something that no one else has tried in the past. So I'm very happy to be able to share with you. So we have new questions as well. Okay, how many ml in total can inject in one session? Okay, so every vial has 3 ml. Okay, so I have injected 4 vials at the most, which would be 12 ml. Okay, so it is depending on where you're injecting. Of course, the patient is going to start feeling that it's a little bit too much. Okay, so if you're injecting here, 1 or 2 vials are more than enough. Okay, because she will go with a turkey skin, because there's a lot of liquid that you have been injecting, and then you have to be able to deal with that in the postoperatory period. That is, there's no inflammation, there's no irritation like with ursodeoxycholic acid, there's no inflammation like with phosphatidylcholine. So that's why it's so much better, because the patient don't feel any pain during the injection or during the healing process. And the results, they come day by day, and the patients, I don't have one patient that is not happy with these results. I don't have one patient that has complained that they don't see any difference. Okay, and I have been injecting it for, let's say, 8 months, maybe 12 months. So that's why I encourage you to try it, because it's aesthetics is the science of the perceived results. If I think that I'm the best rhinoplasty surgeon in the world, but I perform rhinoplasty on my patients and my patients are not happy, I'm done. I cannot do rhinoplasties anymore, even though I think I'm the better in the world. Because the most important thing is what your patient thinks about your job. So if you're injecting some boosters and your patients are happy and they come back and they ask for more, you know that you're doing the right thing. Okay, so that shape also works with microneedle in double chin, or we need to inject. Okay, good thing. So remember that I was discussing with you the fact that when we are liposucting, high definition liposculpture, we need to get inside with the cannula and be like really extracting the fat, like we do with Parmesan cheese when we are like scrubbing to get the cheese out. Okay, this is the same thing with the cell booster shape. What happens is that you have to be able to grab the fat and place the material deeply within the fat pad. Okay, because this is something that, of course, it won't act just in the place that you injected, but the closer you are to the target tissue, the better the outcome you will have and the faster the outcome you will have. Okay. I have more questions, I think. Podría poner la posibilidad se aplica post Bichat. Okay, I will go back to show you the Bichat pad apply application, even though okay, I think it's only on the video, so I'm going to just pause the video where you want to see it.
Keeping me safe and sound, and when I fall, you tied a rope to me.
Okay, here you have the image. Okay, I'm working with a 5 ml syringe. I put 3 ml on each side, and it totally works. It totally works. Okay, you can be confident that you will have a good result. What is the depth of ingredient? I have to go with a double chin. Okay, if you are applying shape for double chin with micro needling, of course you will be 4 millimeters. Okay, and 4 millimeters, it will melt the superficial compartment of the fat that you have. But if you are applying to get really rid of the double chin, you have to be applying it deeply as well. Okay, you have to be applying it 1 centimeter into the depth. So here I use 31 gauge needle because the material is not viscous. Okay, but you can go all the way into the depth of the tissue. You start to aspirate a little bit to be sure you're not injecting a vessel, and then you inject it all over here, and then you massage it gently. Okay, you have to be able to inject it deeply to be able to get rid of the deep far compartment which are in here as well. Okay, what else? Oh, regarding the Bichat fat pad, I'm going to present a lot more in Monaco, so I encourage you to come or attend virtual. We'll have very nice material, new material for you. Tape is better to apply by injections. In my point of view, yes. Okay, lift is better to apply with cannulas, and shape is better to apply with needles. So another question here: can more than 2 vials be used for one session? Yes, I have used even 4. So I think that like, you know, common sense is the most uncommon sense of all. I mean, common sense makes me think that, for example, if I'm treating buccal fat pad, I will inject 1 vial in here, 1 vial here, and if I'm treating double chin, I can inject 1 or 2 vials here. That will be 4 vials. Can we put more vials of leaves and other things? Yes, you can. But as soon as you are combining too many things, then you won't be able to analyze objectively the results of your treatment. So I would advise you to inject 4 vials at the most in one session, see the results, and then come back. Do I risk even bumps with fat dissolving? No, no bumps. Very homogeneous effect, very even results. You cannot see anything that is irritative. When we do neck liposuction, there's a lot of post-operative massage that we need to do to get an even result. We get fibrosis, we get very thick tissue that we're touching, but with CELLBOOSTER, you don't have that problem. CELLBOOSTER is intracellular effect, okay, and it gets some extracellular matrix retraction, so you don't have that problem at all. How does CELLBOOSTER here in SIM5 offer the test inhibit it? Well, that's a different topic, but I can answer you privately that because it's not really the topic of today. I think I don't know if we are. I think I have answered everything. So I think we have done everything. So I thank you very much for your presence today, for your confidence, and give it a try. You will be very happy with the results. Let's see you soon. Okay, I will prepare a lot of material of Bichat fat pad for Monaco. It's around the corner. Okay, it's going to be by the end of March. So we are around the corner. We are at the end of February right now. So in February, March, it would be 1 month from now, and we'll show you a lot of new things. And it was a pleasure to be speaking to you. And so it was a pleasure to have you here. Thank you so much for your confidence. It's been difficult these times of COVID, but I hope to see you personally in Monaco and be able to answer all your questions. If you want to contact me through Instagram, send me all your questions. I would be more than happy to answer them and give it a try. Give it a try really, because it's a very, very difficult product. It's a very good material, and a kiss to you all. Thank you for being here, and merci beaucoup. Gracias a los españoles. Thank you very much, and see you soon. Okay.